Good afternoon, everybody, and thanks for joining us for today's Healthline Free. I'm Jan Elkins, where we like to focus on ways to live a healthier, happier, and pain-free life. Today, we'll be taking your calls and answering your questions live in the studio, and we'll be opening up the phone lines in about 5 minutes. As a reminder, if you decide to call in, we ask that you please make sure you are in a quiet room when you call with your TV turned all the way down so we don't hear that echo. Our number to call is 318-219-4569. That's 318-219-4569. And today's topic, innovations in joint treatment. And joining me to talk about this is Dr. Vic Chatrath with Willis, Knighton, and we appreciate so very much you being with us today. And for viewers who may have chronic pain, what do you recommend?
So, depends on what age group we're talking about. If it's people in their 30s or 40s, is it related to an injury that they're having chronic pain, which is most commonly the case? Or is it patients who are in the senior age group where wear and tear has caught up with you, okay? And what we call arthritis has caught up. So we tailor the treatment depending on who we are dealing with, so there is no one size fits all.
So a lot of people think that they're too young to have these aches and pains in their joints, but from what you're saying, we're really not.
Exactly. So let's take the example of tennis. Since I used to be a tennis player, I see a lot of my own friends who I have treated with tennis-related injuries. Okay.
Like tennis elbow, you mean?
Tennis elbow is the most famous one, and surprisingly, 90% of the patients with tennis elbow don't get it from playing tennis.
Oh, how funny.
Yeah. So they usually get it because there is an imbalance in the muscles along your elbow and your arm, and doing repetitive motion even at home. So many homemakers, females, who are taking care of their kids, doing regular household work, some of which is repetitive, will get tennis elbow, and they've never played tennis.
Yes, I understand. So then for the older group, a lot of us just say it's just part of getting older. Is that true?
Not really. Some part to an extent is, as we grow, we go through life, it's like getting gray hair. Now I've got a little bit too here now, which I did not a few years ago, right? But when it's accelerated arthritis, which is stopping you from, playing with your grandkids, going for a walk, playing golf, doing things that you like to do, that's where the role of some medical treatment comes into play.
In the last 10 years, what are some of the changes or the advancements that we've been able to appreciate?
So, like I was talking in the teaser that we did earlier, I hung my hat my entire career on being at the forefront of technology, whether it was minimally invasive joint surgery, whether it was robotic surgery, whether it was artificial intelligence. I have always tried to get this into my practice so I can offer it to my patients. In the last 10 years, robotics has become mainstream. So, for example, the knee replacements we do are all robotic. The hip replacements that we do, and I've brought this to the audience before, we use something like the Iron Man glasses.
Yes.
It looks like the Meta's Oculus device, and that helps me get an exact anatomy of the surgery that I'm doing, things which we did not have 10-15 years ago. Then minimally invasive surgery, I pride myself on offering that to my patients, where we don't cut the muscle, we go between the muscle. Okay, so instead of cutting across, we go between the muscle. So you can imagine the blood loss, the scarring, the recovery time, all that gets cut almost in half with the minimally invasive approaches we use.
When you talk about robotic and the use of a robot in the operating room, the robot's not doing the work. You're still doing the work. You are still a required participant, but they do help. It's like a tool that you have.
Correct. So think of it, I'll talk in terms of plumbing and carpentry, because a lot of orthopedics is truly that, right? So when you have a stud finder, okay,
Yes.
or a plumb line, okay,
Right.
or a laser line, what does it do? It helps you find the level. It helps you find the stud. It's a tool, but if you have a bad carpenter, things can still go wrong.
That's right.
So I am 100% in control of what is going on. The robotic arm gets the feedback that I put in there.
Now, when patients hear joint surgery, whether it's shoulder, knee, elbow, hip, whatever it is, a lot of times patients think, oh, that means a long recovery time, a long time in the hospital, but that's really changed, hasn't it?
Absolutely. That's changed tremendously, where I do knee, hip, and shoulder replacements, large joints. They get up 2 hours after the surgery when their legs kind of have woken up, and the therapist will help them walk. Majority of them can go home the same day right after the surgery. And if you live in the Louisiana area, it becomes very easy where I can actually send home health to your house. So you don't even have to drive to physical therapy for the first 2 weeks, okay? And the convenience factor, the recovery part has improved tremendously. On top of it comes the medications that we're now able to use. So for example, for hip and knee replacements, we don't have to put people to sleep all the time completely. We can freeze your legs down from the belly button, okay, and keep you in a twilight zone. Why? So you don't have to deal with what's going on in the operating room, especially my dad jokes. Those are dangerous.
So, outside of the bad jokes,
Yeah.
it's better to have less anesthesia.
Absolutely.
To be able to recover faster, wake up quicker, not just your brain, but your entire body to wake up faster.
Correct. Especially joint replacement surgery is usually people 50 and up. Okay, so we want to decrease the amount of anesthesia, especially in that age group. And this is where the role of these medications. Then we use a lot of blocks.
Yes.
So nerve blocks mean if you are having a shoulder surgery, we'll block the nerves that go to your shoulder and numb it up. So the amount of narcotics and medications that I have to give are cut down tremendously.
So when patients are talking about it, a lot of times people think that a hip replacement is an older person's issue, but you're seeing younger and younger patients who need hip replacements now. Is that right?
Absolutely, absolutely.
What's causing that? Do we know?
So we're very active with sports,
Yes.
right? And earlier it was thought that if we operated on someone in their 40s, well, this will last only 10 years.
Right.
The quality of the joint replacement has improved so much that that's your active working period. So let's take the example of a 40-year-old who needs a hip replacement. Now, do we let him fall out of the employment, struggle financially? This is the time to, feed your family. We do a hip replacement. If I can get 25 years out of it, now he's 65, almost at retirement, where they have led a successful career. If at 65 they need a redo, our tools are great now. They've improved tremendously where a redo is not a problem.
That's awesome to hear, because I know a lot of people have struggled with the pain, thinking that they should endure in order to get to whatever age they felt comfortable. But you're saying that that's not the way it should be. We should go ahead and get healthier in order to move more.
Absolutely. So, avoiding surgery, probably the number one thing where
Sure.
you're keeping your muscles strong, you're having a healthy diet, a healthy lifestyle, controlling your weight. Now, if you've done all this and we're not getting anywhere with it, well, surgery is a decent option now. In fact, even think of it 20 years ago when I was training, At that time, my professors did have to tell patients, you're too young to have surgery, you'll have to live with it for the next 15, 20 years.
Wow.
So if you're 40 and you had a bad knee or a bad hip, we couldn't help you. That's changed.
That's a blessing.
Absolutely.
So again, when we talk about things like this with the age, a lot more has changed as far as stem cell, PRP. How does that fit and play into your practice?
So you just brought up one of my new favorite topics. Thank you. So PRP and stem cells. So let me give you the simple premise of this. Okay, I'm going to absolutely keep it simple words. Let's say I get a cut here on my hand. I'll bleed, right? But then if it's a tiny scar, but my skin comes back. So the blood has three parts to it: the white cells which fight infection, the red cells which carry oxygen, then the platelets which help the blood clot and things to grow back. So growing back tissue is where, you know, the million-dollar question was, how do we grow back tissue? So if you're, let's say, 35 and you get early arthritis, I can give you injections, I can clean it up, could not grow back your tissue. Now what we do with the stem cells, we'll do a lab draw, we'll spin it in a centrifuge machine, and we'll get a concentrate of those platelets and inject it wherever there's a problem. Now, that's the good part of it. There's a bad part too. The bad part is insurance still considers it experimental, so they don't pay for it. So it's something that the patients have to pay by themselves. That's the prohibitive part to it.
So while stem cell, taking your own cells,
putting it in a
doing
centrifuge,
the centrifuge and separating the blood, putting it back in that same patient, which means there's no rejection problem.
Correct.
And they are able to use it, you still have to pay for that out of pocket.
Yes.
But it is highly successful.
It is becoming more and more successful. We are realizing we have now better machines. Even the concentration of how much to put in, we can dial that now. Okay, so those things have improved. Till insurance covers it, I'm not able to offer it to the entire patient population because, you know, cost becomes a factor there.
Of course. What does PRP stand for?
Platelet-rich plasma.
Platelet-rich plasma, which in many cases is your own.
And it is always your own.
And so you're able to put that back into the area of the body that is in pain, which means normally you heal, you are pain-free, which again is what Healthline 3 is all about. We're trying to help people live happier, healthier, pain-free lives, but there's still some questions about it.
Yes, as with any new technology.
Yes.
So think of the example of rotator cuff. It's a very common problem. People get inflammation in their rotator cuff. It's not bad enough to need a surgery, okay? But it is not getting better with physical therapy, medicine, steroids. Now what do? Now you're like stuck in the middle.
Right.
This is where the role of PRP can come in, where I can do a PRP injection and see if we can help the tissue to calm down. The micro damage that we have, can we reverse that?
And does that buy the patient a little more time to where they may not have to have rotator cuff surgery as quickly?
I would not use the word absolutely.
Yes.
But I would say majority of the times, yes. It is an evolving science, and like I said, I've always tried to be there when I can find something more to offer my patients.
So that's at least an option and hope for the future if you're able to have that done, if you need a rotator cuff surgery, for example.
We've used that for knee arthritis, hip arthritis, tennis elbow actually, and rotator cuff. Those are some of the common things I've used it for.
So at what age does a person need to be aware that their joints are either wearing out or beginning not to function like they used to in our youth?
So it used to be in their 50s, but you know, 50s are the new 30s now. People are more active, they're more aware, they look at more options. So I would say even in your 30s, if you're starting to hurt, there has to be a reason.
So, this is just a question that you mentioned that sports and athletics, that all of these things contribute to problems later on. But sports and athletics and moving and staying active are a big part of our lives, and they seem to help our bodies. Is it still a good thing to be involved in sports?
100%.
Good.
Okay. Because you would rather stay healthy, active, energetic, keep your bone health good by playing sports, whatever your ability is. Okay. Not everyone has to run a marathon. Go for a walk.
Thank you for that.
Yeah.
I don't intend to do that, so thank you for permission. Now I can say, my doctor told me, I cannot do that.
So the National Institute of Health actually says we should get 30 minutes 5 times a week of weight-bearing activity. Okay, weight-bearing activity can be a walk for somebody, it can be a run for somebody, it can be going to the gym, it can be playing tennis, playing soccer, whatever you want, but some weight-bearing activity.
And one of the most talked about things you mentioned a few minutes ago, that regenerative cell help. Do you think modern medicine is really going to focus on that in the next 10 years like they have in the past 10?
Absolutely. So in the past, our options were kind of restricted to what we call steroid injections.
Yes.
And then came about gel injections. People commonly call them as rooster comb injections. Those gel injections were thought to be, it will restore the normal gel that we have. That didn't pan out very well. We still use it as one of the tools, but it didn't do what we thought it would. So we've gone back to using our own tissue, which, like you pointed out that it's your own tissue. So no rejection, it's safe. And if it can grow back the tissue, that's where the research is happening. I'm hearing about research coming out of California, coming out of Germany, where they're trying to recreate the cartilage to grow back. The only problem is it's not consistent across the board. Hopefully, next 20 years, it'll be.
How do we get it more consistent? Is that what the research is all about?
Yes, of getting more consistent results. So if they can grow it, they're right now growing in mice, right? But will the same thing translate to human data?
And we don't know until the medical technology gives us the research on that, and
Correct.
And you're able to share it, and then have patient trials, personal trials. And so I think that's very good. But also there's some confusion as to whether or not actually, is it the medicine that's making a difference? Is it the human body? Is it our attitude, our brain? Seems to me all of these things are coming together.
All the above. The patients who tend to do the best are the ones who show up to clinic with a positive attitude. I'm going to get better. That even if I need an operation or I don't need an operation, I'm determined to do better. Those patients amaze me. Like, I've even had some patients in their 90s who have come for a planned hip replacement or a knee replacement, not an emergency, a planned one. And their attitude was like, I wish I'll be like them when I'm 90 years old. So the mind over matter is amazing.
So when a person comes in and there's no time limit then, there's no age that you would say, look, you're too old to have it, because if a person's in pain and comes to you and needs a knee or a hip, they could live to be 100.
Yes, we still will do all the checks and balances.
Sure, of course.
That medically, can they handle an operation which involves a surgery, losing blood, getting medications. If we can do it safely, we would go ahead.
Good. And I think we have Pamela on the phone now who has a question. Hi, Pamela. Thanks for calling in. Go ahead with your question.
Hi, thank you so much. I am 72 years old. I've had both hips replaced and one knee replaced. Now, doctor, my shoulder is killing me. It's between my arm and my shoulder. Hurts so bad. they can't replace the shoulder, can you,
She says that she's
Doctor?
got a lot of pain in her shoulder.
She cut out for me a little bit.
She
but
did for me as well.
Yeah.
Yes.
So, Miss Pamela, thank you for calling, and I think I got most of your question. If you've had both hips and a knee replaced, it tells me that you suffer from large joint arthritis, and that may be going on with your shoulder as well. Of course, I haven't examined you or looked at the imaging, but that is something which we treat every day, multiple times a day. So I do not want you to be in distress. This is something which is very fixable. We can definitely help you with that. If you want me to help you, please feel free to make an appointment. I'm at Willis, Knighton, Bossier, and our phone number is 318-212-7841, and I would be honored to be of any help.
Thank you, Doctor.
7841.
Yes, ma'am.
7841.
318-212-7841.
212. And your name is
Dr. Vic Chatrath.
I can't spell that.
Just if you call, just say you spoke to Dr. Vic. That's easy.
All right, maybe Jan can spell it for me.
Like the doctor said, just call and say that you spoke with Dr. Vic, VIC, and they will get you to the right place.
And Jan, I've been watching you since we were both young, pretty women.
You probably were in the crib when I started, because I have been doing this a long time. But we do appreciate, Miss Pamela, you calling in, and we hope that you get the help that you need.
Thank you. I'm going to call Dr. Vic's office.
Yes, ma'am.
Thank you.
Thank you. I appreciate it.
All right. Now, Doctor, we've just been talking to Pamela, who may be a good candidate because obviously, as you said, she's had some other knee and hip replacements. We've talked about stem cell PRP. Who is not a candidate for those types of injections?
So, people with advanced arthritis, if we divide it into mild, moderate, severe, or advanced, the ones who are moderate to severe or severe arthritis, they are not the candidates for this. At that point, it's become a mechanical problem. If I can use the analogy of a car, think of it like the wheels on your car have rubber on them, okay? So if your rubber has wore out a little bit, the treads have wore out, you can still keep driving the car. But now, if it's absolute bare, you're at a risk of having an accident, right?
Yes.
So that's where the stem cells cannot work for you.
Yeah,
So-
you could still do the procedure, but it's not going to help the patient
Correct.
at all, therefore it doesn't help you.
Yes, absolutely.
The patients who are not a candidate for that are those where it's gone too far.
Gone too far.
Okay.
Yeah, absolutely.
good.
And you know, like I said, this is something which insurance does not cover. So I tend to be even more selective.
Yes.
That I don't want you to feel that you wasted your hard-earned money on this. So I tell them, you are not a candidate for this.
Good for you. So when we talk about the wear and tear on the body, are there certain jobs, are there certain sports activities or certain activities at home? I mean, you know, I would love it if you tell me I'm not supposed to vacuum anymore. You've already told me I should not run a vacuum cleaner. I mean, a marathon, so.
Well, I'm going to leave the vacuum cleaner.
Okay.
So, yes, a lot of professions, including mine actually,
Yes.
you will not realize how physical my own profession is.
The
with
repetitive motions there.
correct.
I understand.
So that's a very high risk profession for having injuries, orthopedic injuries myself. People who work more in the automobile industry or heavy manual labor, repetition, they tend to have more joint related problems than others.
So that's a good thing to be aware of. It's not that you can't do those jobs or shouldn't do those jobs, it's just be aware because knowledge is key, isn't it?
100%. Like, for example, whenever I see patients who are like carpet layers, roofers, they will come with knee problems. So, well, you cannot leave your profession, but you can wear a knee pad.
And
Simple.
a lot of people, and I hate to say this in a way, are too proud to do that, but it can certainly extend the life of their career.
Absolutely. Especially you get infection around the knee, you get small tiny cuts you don't even realize, and then they'll show up in the ER with an infection. And then I'm like, well, let's wear knee pads next time and prevent that, because you're working in an external environment. So that's just one of the examples where follow appropriate precautions, and even if you're doing these repetitive jobs, you can still function, have a healthy life, have a healthy career without getting injured.
Will everyone who lives long enough have some sort of joint injury or joint pain?
I think so. With the wear and tear, some of us will always have a little bit going on here and there.
Yeah, so sometimes we get that a little earlier than we would like. So the approaches that you've been talking about, not just the medicines, but the regenerative type things, have really helped the patient get out of the hospital earlier and back to those normal activities.
Absolutely. For example, 30 years ago, if you had a tear in the cartilage, they opened it up and had to repair it. Then the camera surgery, or what we call the scope, came along. Okay? So my generation of orthopedic surgeons always did the scope. But sometimes we see patients who've like, hey, I'd had this done 35 years ago, and you see this big a scar. Whereas now it's a keyhole surgery.
Yes.
So just like that, we keep progressing with what we can do, what we can offer. One of the very interesting things which I did for a young athlete, which actually they covered that in the news as well. There was a news article. This 22 or 23-year-old gentleman had a big chunk of cartilage just gone completely. Now he's 23. I'm like, we really cannot do a replacement here. What do we do? So we got actually a graft from a cadaver. We shaped it, matched it to match his entire anatomy.
Amazing.
And we used a CT scan to match it. It was the first surgery ever done in Willis, Knighton of that kind. So I put that graft there. I just saw him for a 6-month follow-up. He is so happy. He's back to sport. Came in, we hugged, and we took a picture together. It was wonderful.
That's incredible, because 30 years ago that could not have
Could
happened.
not be done, no.
And that's why I think sometimes if you're having some problems or experiencing pain, and sometimes patients will say, well, I've already been to the doctor about that, or I tried that and it didn't work. Try it again.
Yeah, absolutely. I mean, options have changed, and you know, I have great colleagues in the system. If this is something that is not my area of expertise, I will get you to the right person as well.
Yes. And so recovery time now for, say, a knee or a hip replacement?
By 6 weeks, people are doing pretty decent with it.
Wow.
Yeah.
You've come a long way.
I know,
haven't you?
it's come a long way, where you know, people are able to go back at least to regular jobs. If they have a more physical job, I would say, okay, let's take some more time. But that's changed quite a bit.
So how long do you think it'll take the insurance companies to talk more and receive positive outcomes for PRP?
You know, the American Academy always, that's where all the orthopedic surgeons we are members of, we try to push and try to get legislation done for it. So, but insurance companies do push back.
Yes.
They don't want to pay for it.
But the whole thing is medicine, technology, AI, there are so many things that are active right now that it may be sooner than later.
I hope so. I hope so, because this is one of the things I would love to offer more of my patients, where cost is not a barrier and I don't have to base it on cost. That is one of the things I absolutely, absolutely dislike. I want to treat everybody, regardless of who they are, what they earn, with the same degree of respect.
Doctor, thank you so much for being with us today. You have been a wealth of information, and we're so grateful for you being in the studio. And again, just a reminder that Dr. Vic Cathcart is there and to help you if you need it as an orthopedic specialist, so feel free to reach out and call him. For KTBS 3, I'm Community Projects Director Jan Elkins.